Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
My name is Sister Patricia Spate. I'm a Franciscan missionary sister for Africa, and I come from Ireland. I was appointed to Nakuru in Kenya by our congregational leader in 1997, and I was asked to look for the needs in Nakuru. So during that time, I was accompanied by a volunteer who showed me around all the very, very poor and marginalized areas in Nakuru. And that time I was to look for the biggest needs. So following the 6 months needs assessment, the biggest need was people wanted a community home-based care program for people suffering from HIV and AIDS. Because at that time, HIV and AIDS was rampant in the community and people were suffering a lot and left to die because there was no antiretroviral treatment. We started our program in that little tiny room under a tree in 1997. And I called the program Love and Hope because I felt that this is what God was calling me to do for Him and His people. As the years went by, you can imagine the needs changed. The basic thing was the HIV and AIDS, which is still with us today. But there are many other needs now that have cropped up and we have now reached out to. So a lot of people today are suffering from cancer. They're the very, very poor people that don't have any money even to get the basic drugs that are required, the radiotherapy, the chemotherapy. And actually they come to us in tears asking, please, please try and help me. Try and help me because I want to be able to live. I want to be able to give my children a life. But if I have no help, it means I go home and I die. So we follow the people up in the homes. We try to see if they can also help us so that we can help them. So it is one of the very, very big needs in the program.
We've known the Love and Hope Center as an organization that has been helping us with our patients in so many ways, because here we see the cancer patients, and Love and Hope have come in handy to help some patients in paying for their NHIF. They've paid for some patients for surgery. They've even helped some patients to get treatment for the condition that they have at Nakuru Level 5 Hospital. From 2018, the inception in May up to December of 2018, the numbers by then, they were not very high. We were doing between 10 to 15. But the beginning of 2019, now people knew so much about the center, and we started interacting with you and welcoming you to the hospital in case we had anything. So from 2019, the numbers rose triple that. And then in 2019, 2020, 2021, the numbers again rose to almost double that. So right now you are helping close to 120 patients from the Nakuru Level 5 Hospital. Yes. The burden in Kenya is, right now it's still quite high, even if we compare our numbers with Globocan, because we are capturing much of the disease in stage 4, where there's less for us to do. Yes, there's something for us to do, but we are going to reduce the quality of life if we had captured the disease earlier. For Geoffrey, I have known him since end of 2018 when he came here with adenocystic carcinoma. We started him on first-line treatment of chemo, and he responded very well. And then after that, we were on active surveillance to see if the disease is recurring or if the patient is getting better. And then 7 months after completion of chemo, he got a recurrence of the disease, and we put him on second-line treatment, which he did very well. But in between treatment, he got disease progression, and we decided that he should be on maintenance chemotherapy until we see that the drug is not working anymore. But so far so good, because the tumor which he had, it was very big, But right now, as much as there's small reduction, but at least there's reduction. We can see there's something the drug is doing. Yeah, so, and the Love and Hope Foundation came in handy because when his cover was depleted and we had to wait for almost 4 months before the financial year for NHIF started again, you people helped him so much. He has never missed treatment. He has been on treatment because you've always come here, you've always been able to pay for his bills, and he has always been on treatment. So we appreciate what you are doing and continue with the good work.
Nimekosa pesa, nitakaa nyumbani miezi 3, lakini wakati mimi nilianza kunisaidia, mimi ninaona mimi ni watu wema. Kwa hivyo mimi ninaomba muendelee kuwasaidia hivyo hivyo, na Mungu awapatie nguvu na uwezo mwingi ndio mkaweza kusaidia wengi. Mimi ninafurahi sana na mimi, hata sijui niseme nini isipokuwa niseme Mungu awabariki.
Well, I would love to appreciate everybody who has come in handy at the Love and Hope Foundation. We really appreciate what you are doing for the foundation. You have helped so many. We would love to appeal from all of you. You have helped so many. Some of them even right now they are cancer free. For our well-wishers, what I'd request you to do, whatever you are doing is immaculate. We cannot even be able to pay you back. And we would hope and wish that you continue with the same, because you have helped so many. Not only in the oncology services that are here and way beyond what we can be able to give at Nakuru Level 5.
To the local community and to the wider community, please help us to be able to help the people. And it's really, I'm really begging you, because at the moment we're in a dire straits. Donors have pulled out. During this time of COVID-19 last year, it was one after the other without any preparation, without any exit strategy. Nothing, because they were now dwelling in their own countries, trying to help their own people. So today I am begging you, please, please, if you want Love and Hope to continue, if you want us to be able to go out and serve the suffering people, and as you all know, Jesus is in the suffering people. When you give to us to be able to help the people, you are touching the life, God's life in that person. So I plead with you, I'm just pleading you with the bottom of my heart, unless you help us to be able to help the people, we are not going to continue, be able to continue. Do you want us to continue at Love and Hope? Do you want us to keep serving and helping the people that God has called each one of us at Love and Hope to serve here in Nakuru?
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.